Okay, so your time starts now.
Hello, Miss Aisha.
Hello, doctor.
I am Dr. Hafsa with you. What can I do for you today?
Doctor, actually, I'm so much worried. I have not had my periods for past few months.
Okay, can you please tell me more?
Yes, doctor. Actually, my periods used to be like every 30 days, and it lasts for 5 days. Since I was 13, but last 4 months, I'm getting on and off few periods.
Okay, okay. So, for the last few months, you said you are having irregular period, yeah?
Yes, doctor.
Yeah. So, can you please tell me more? What do you mean by that? It is irregular?
Actually, doctor, I didn't have the last period since 4 months now.
Mm-hmm. Okay. So, are you married?
Yes, doctor, I have a partner.
Okay. And do you have kids before?
No, doctor.
Did you check for pregnancy test?
No, doctor.
Okay. So, along with this amenorrhea, do you have any like vomiting,
No, doctor.
any pain in your abdomen?
No, doctor. But I just have this pain in my breasts. Sometimes it feels tender, and somehow I feel nausea in mornings.
Okay, okay. So, is it recently or is it before you have this tenderness in the breast? Marco?
It just got recent now.
Okay. And with this breast tenderness, do you have like your mood is low?
No, doctor.
Okay. Any heart racing?
No, doctor.
Okay. Miss Aisha, is this thing, it happens for you first time or long time before you were having also these same complaints?
Doctor, it's just the first time. But
Okay.
as you asked me about the pregnancy, doctor, actually, I'm not sure. It could be
Mhm.
possible. I did a home test 2 months ago and it was negative.
Okay. Okay. So it means that you are willing to have pregnancy?
Maybe, doctor, I'm not sure.
Okay. Are you using any contraceptions or maybe you used before?
No, doctor.
Okay. So apart from this, do you have any headache,
No, doctor.
any blurry vision?
No, doctor.
Have you noticed any acne on your face?
Yes, doctor. This acne, sometimes I'm getting this uh, since few weeks now.
Okay. And is there any unwanted hair growth on your any part of your body?
No, doctor.
Okay. Just few more questions. Do you have any medical conditions before?
Uh, Doctor, actually, I'm well, but apart from this acne, I don't have anything else. Sometimes, when I was a teenager, I had the similar problem, and I had this facial hair on my
Mm-hmm.
chin. But after that, I don't get it now, but acne is still there.
Okay. Okay. Have you been diagnosed with high blood sugar before?
No, doctor.
Any family history of high blood sugar or irregular periods in your family?
Yes, doctor. My mother is diabetic, and
Mm-hmm.
my aunt, they said she has something in her ovaries. I don't know, something cyst.
Okay. Okay. Are you taking any medications due to any reasons?
No, doctor.
Tell me about your diet in general.
I take a balanced diet.
Okay. And do you do exercises?
Sometimes, doctor, but I don't get time.
Okay. May I know why?
Doctor, actually, I'm manager in a bank, and
Mm-hmm.
it's all time sitting job, so
Mm-hmm.
somehow I don't get time. And when
Okay.
I'm at home, I'm cooking or I'm doing a home chores, so that's why.
Okay. I see. I see. So, do you smoke?
No, doctor.
Do you drink?
No, doctor.
Okay. Miss Aisha, what do you think is going on with you?
Doctor, I'm wondering if my hormones are messed up or if I have something like my aunt have.
Okay. And what makes you worry the most?
I'm really scared that it means I will not be able to have children in future. And I'm also a bit worried that even though I have a partner, but could it be a pregnancy, doctor? And the
Okay.
test might be wrong.
No problem. We will see it. Don't worry about that. And what do you think I can do for you? Hello? Hello? Dr. Musarat, can you hear me?
Hello?
Yes, can you hear me?
Yeah, now I can hear you. I resume the timer. Can you ask again, please?
Yeah. So what do you think I can do for you?
Yes, doctor, I was hoping you could do some tests and tell me what's going on.
Okay. And how it's impacting on you apart from thinking that you might have this similar condition like your aunt?
Actually, doctor, I'm already stressed due to my work, and this condition is also stressing me out.
Okay, okay. So let me summarize. Miss Aisha, you say that for the last few months, your period became irregular, and you have noticed also the acne appearance on your face, and you are worried that it might be something like your aunt, and you want me to do your some blood investigations and to see what is going on with you. Am I right?
Yes, doctor.
Okay, so Miss Asma, actually, what it looks to me after seeing you, you might be having something called. But for that, I need to ask you one question. Do you know about your BMI, body mass index? Amat tamang ko
Yes,
kaya?
doctor, it's 32.
32. Okay, so what it looks to me, you might be having something called polycystic ovarian syndrome. But for that, I need to do some blood investigations for you and some ultrasound for you. So is that okay?
Sure, doctor.
Yeah. So for this reason, I would like to send you to the gynecologist to request for you an ultrasound, and then I'm going to do certain blood investigations like full blood count, kidney function, thyroid function, liver, lipid panel, and also HbA1c and fasting blood sugar.
Okay,
Any
doctor.
any finding? And also, as you were concerned, you might be having pregnancy. So for that reason, also I will request for you pregnancy urine pregnancy test or blood for HbA beta HCG. Any finding?
Beta HCG negative.
Okay. And what about the others? Blood investigations and ultrasound
Pending.
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 Okay, Miss Aisha, as I told you earlier, that it looks to me that you are having irregular period and you have the development of acne on your face. So these things looks like you might be having polycystic ovarian syndrome. Do you know that? What is that condition?
Yes, doctor, my aunt has similar. I don't know it's a problem in the ovaries.
Yes, this is if there is some cysts which normally should not be there. If these are present in the ovaries, it means that you are having polycystic ovarian syndrome. And you are right that in this condition there will be abnormalities of the hormones. Okay, for that reason also I would request to do certain hormones for you, like full blood FSH, LH, testosterone, prolactin as well.
Okay, doctor.
Okay, and if it is that the
Yes.
condition, yes, you're right, sometimes it makes the pregnancy difficult, but don't worry, because there are certain investigations and treatments that can be given if you are willing to be pregnant in the future, like the specialist will give you some clomiphene citrate and all these. But for now, Miss Aisha, it's very important to take care about your diet, as you told me that you are eating everything. So it's very advisable that you should eat a healthy diet and do some exercises to reduce your weight, because that will
Okay,
really
doctor.
help you. Yeah, because that really will help you in achieving the pregnancy. Beside that, it's also important to check your blood sugar level, okay, or at least once per
Mm-hmm.
year. And beside that,
Time's up.
okay, thank you very much.
Okay.
Thank you. Thank you.
Okay.
I did not go
Dr. Hafsa,
safety.
when to come back?
Safety netting. Yeah, I was just so I would like to see you after you have been seen by the gynecologist, okay? And then
Mm-hmm.
yeah, and meanwhile, if you find that you have heavy bleeding that doesn't stop, or you find that you have severe headache, then please make sure to come to us again directly.
Okay, doctor.
Okay,
Okay,
thank you
Dr.
very much.
Hafsa, you're welcome. In this case, first we, what I observed that we have to go through the history in detail for the menstruation. Like presenting complaint was every 30 days she was having periods and lasting for 5 days. So you need to ask the how is the flow. Even when she last got the 4 months back, still we need to know how much was the flow. So it was moderate flow, and menarche should be asked. She was 13 years old when she started having period. Last menstrual was 4 months ago. Since then, we need to ask, do you have any bleeding or any spotting in these 4 months? And are you sexually active? You asked. And are you taking any contraceptive? She wasn't taking, just a barrier method. And pelvic pain. Whenever there is a menorrhagia problem, yeah, we need to ask how many days and the duration of the cycle. Third is if there is any pain during the cycle and um, how much is the flow. These 4 points we have to ask the patient. And side by side, we need to know if there is any discharge, any pain while intimacy, like dyspareunia, okay, or any vaginal bleeding. So regarding pregnancy, she is sexually active with one male partner, contraception not using, and she did pregnancy test 2 months ago, and it was negative. But still, we have to rule out at the clinic. And pregnancy symptoms, she was having mild breast tenderness and nausea for the couple of weeks. But still, even though she is having these symptoms on the pregnancy test, it was negative. So we will still go for DDs like PCOS. When we go for the systemic symptoms, we need to know a few more things. Like whenever there is disturbance in menstrual cycle, first hypothyroid, PCOS, and hyperprolactinemia. Yeah, right. Like in central cause, thyroid cause, and lower down the ovarian or uterine problems should be ruled out. So weight changes. She almost gained about 6 kg over the last year. She didn't have any headaches or visual changes ruled out for any hyperprolactinemia, any galactoria, or any hot flushes or night sweats to rule out any premature ovarian failure. Severe pelvic pain, she wasn't having, it's a red flag. Postcoital bleeding or intermenstrual bleeding is a red flag. Symptoms of the thyroid disease, like we need to ask, are you feeling more cold than others? Are you feeling constipated? So just rule out what is the exact diagnosis. Sometimes the patient might be having a hypothyroidism in this case. And she wasn't having any palpitation and no bowel habit change. In the gynae and obs history, um, no previous pregnancy, no miscarriages, no termination, and we need to ask if she's having any infections previously or any course of antibiotics like for PID or any surgeries before that. In past medical, she is generally well, no hypertension, no diabetes, but still acne since few months on and off, and facial hair when she was teenager. Drug history, she's not taking anything. No allergies. Family history, mother was diabetic, and her aunt is having PCOS. Stress levels, sleep pattern, and lifestyle. These are three main important things in. Lifestyle should be addressed. Sleep patterns should be asked because of the stress. And when she's having stress, we need to ask about the low moods also. Are you having low mood regularly, or are you enjoying the daily life activities you used to, just to rule out any depression or uh, psychiatric problem? She wasn't smoking, no alcohol. BMI was increased, and there was no exercise at all. Eyes, you ruled out. Okay. And sometimes when the patient having the same concern like the disease, PCOD, so we will tell like you are assuming that you might be having the similar condition like your aunt. Yes, you are having this. I am suspecting you are having the similar condition, but it is manageable and treatable by some lifestyle changes. And furthermore, if the medication is required, we will be giving you. In this case, the examination is gray, but still we have to somehow, if you do, you can get the findings like you will do the vital signs, any signs of acne and hirsutism, we will check thyroid examination. And if she gives you any indication of pain, like pelvic pain at the moment, you can do abdominal examination. Whenever there is a pain anywhere in the body, we need to examine it. BMI was 32, blood pressure, thyroid, all other details. So, in this case, firstly, we have to rule out the pregnancy you did, and she wasn't pregnant. Only one examination finding, that is, negative pregnancy test was given. Secondary amenorrhea. This is the case of secondary amenorrhea due to PCOS. There wasn't any red flag features, so there is no malignancy or acute pelvic pathology. What we do in the primary care, urine pregnancy test, then blood can be done for FSH, LH, estradiol, prolactin, TSH, testosterone, fasting glucose, or HbA1c, or any pelvic ultrasound to assess ovarian and endometrial thickness, ovarian morphology or endometrial thickness. Management plan, explain the diagnosis, how you'll explain based on your symptoms and examination. The most likely cause is hormonal condition called polycystic ovarian syndrome, where the ovaries do not release eggs regularly and can produce more male type patterns, like you have acne and hair on your face. And if the patient doesn't want kids, here in this situation, she's neutral, uh, but she's concerned about pregnancy. So if the patient is not doesn't want the pregnancy in future, we can give the COCPs, but after the lifestyle management. We'll tell her to lose the weight, exercise the first line, 5 to 10% weight reduction will restore her ovulation and periods and improve her regular cycles. And after that, if she wants any medications, not to conceive also, so COCP is the first line. Okay, and they consider metformin if the patient is after lifestyle changes, patient is not getting the weight loss. Otherwise, we just need to rule out other risk factor and safety netting advice to return if heavy or prolonged bleeding occurs after long menorrhea and severe pelvic pain or any new concerning symptoms like headache and any discharge, and arrange follow-up to review investigation results and agree ongoing plan. Sometimes in the OSCE examination, they don't give you findings. They don't give you uh, investigation findings. So you just have to say, I'll be calling you back after the investigations are done. Meanwhile, give the lifestyle management and safety netting. Okay, someone was having a question, Dr. Nahla.
Dr. Musara,
Yeah. Mm.
Yeah,
Yes.
can we prescribe metformin?
we can start, but first line is always the lifestyle. Even if we start
Okay.
the metformin and she's not changing the lifestyle, so it's just an extra burden on the body. So first we
No,
have to convince
we
the
advise
lifestyle.
lifestyle, then along with that, we can advise metformin, or we can say that with the specialist will prescribe it.
Metformin can be prescribed, but first for the first 3 months we have to tell for the lifestyle changes only. On the first
Okay.
encounter of PCOS, we are not going to start metformin, but we will tell if you doesn't get better with this lifestyle changes, I might consider metformin for you. That's how you say it.
Oh,
But
okay, and can't we give COCP pills on the first encounter?
If the patient is concerned about not having the pregnancy, then yes, you can.
Okay, okay, thank you.
But if the patient is having a concern of pregnancy, then you might arrange a follow-up for the patient for gynae, since she wants a pregnancy. So it will be under the specialist care. Okay, next. Any question? Or we move to the next scenario. So here, whenever you have menorrhagia, always rule out hypothyroid, central causes like hyperprolactinemia, then uterine causes or ovarian causes likewise. So, Dr. Nahala, are you ready
yes, I'm
for the
ready.
next scenario?
Yes.
Okay. So your patient is 38-year-old woman, Mrs. Fatma, presents with a problem she wants to discuss. Please take focus history and management plan. And whenever you feel like you want to have an examination, you can have it.
Mm-hmm.
Depends on the time. Your
Okay.
time starts now.
Okay. Hello, Madam Fatma. I'm Dr. Nahla. How can I help you today?
Doctor, actually, my periods have become really heavy and all over the place for the last few months.
Okay. Can you tell me more, please?
Yes, doctor. Actually, I was having normal menstruation before, and just since last 8 months, I'm now having every 21 to 40 days of a cycle, and sometimes I don't know when I'm having this. And the bleeding is so much heavy, and I'm soaking so many pads, and really, I'm worried about my condition.
Mm-hmm. Okay. This is start since when you told me? Sorry?
Since last 8 months.
8 months. It become heavy. Okay. So may I know when your last period?
Uh, it was it it was just a sec. It was 40 days ago.
40 days ago. And you told me
Yes.
it is like became heavy, yeah?
Yeah,
So how many bad you use per day?
doctor, I need to change every 1 or 2 hours for the
Okay.
first 2 days.
Mm-hmm, mm-hmm. Okay. So do you notice that there is clot?
Yes, doctor.
Mm-hmm. Is there is any spot between period?
Mm, occasionally, sometimes light spotting, doctor.
Mm-hmm. Okay. So have you ever awake in the night to change your bed?
Yes, doctor, sometimes.
Mm-hmm. Okay. So do you feel like dizzy?
Yes, doctor, these past few days I'm feeling dizzy.
Mm-hmm. Any heart racing?
No, doctor.
Okay. May I ask you a sensitive question, please?
Sorry.
May I ask you a sensitive question?
Yes, yes, doctor. Yes, doctor.
Are you sexually active?
Yes, doctor.
Okay. Do you notice that you have any pain after sexual intercourse?
No, doctor, but I don't have any pain.
Okay. Any bleeding after sexual intercourse?
No, doctor.
Mhm. Do you use any kind of missed birth control?
No, no, doctor.
Okay. So do you have any, do you buzzer by weather?
Sorry, doctor.
Do you buzzer by weather? I mean, do you have thyroid problem?
No, doctor. What is thyroid?
Any gland problem?
No, doctor.
Okay. So, okay. Do you do any kind of surgery to your tummy?
No, doctor.
Okay. Do you notice any swelling in your tummy?
No, doctor.
Any fever?
No, doctor.
Okay. So, Mrs. Fatima, do you use any medicine for regular base
No, doctor.
or recently?
As,
O-
Dr. Nella, just give me a sec. I'll just stop the
Okay.
timer here.
Okay, no worries. No worries.
Okay. Okay, so in past medical, sorry, I skipped. She is having hypothyroidism and she is on levothyroxine. Okay.
Sorry?
Now she is hypothyroid and she is taking levothyroxine. Okay. I missed this.
Okay,
Now
no
you
worries.
can start again. Yeah.
Okay. So, you told me you have a thyroid problem and you take levothyroxine. Am I right?
Yes, doctor.
Okay. Do you take your medicine regularly?
Yes, doctor.
And do you follow with your doctor?
Yes, doctor.
Okay. A part of hyper thyroid problem. Do you have any health problem else than
No,
that?
doctor.
Okay. So, Mrs. Fatima, what do you do for living?
Doctor, I'm housewife.
Uh-huh. And with whom you are living?
My husband and two kids.
Mm-hmm. Okay. May I know what's youngest age? Your youngest kids, how old is he?
He's 3 years old.
Okay. So, Mrs. Fatima, what do you think might causing this problem for you?
Doctor, I'm not sure. Maybe it's my age or hormones.
Mm-hmm. And what worry you the most?
Also, I'm worried about any cancer because I'm having these heavy periods and it can be a sign of it.
Sorry, I'm worried about what?
Maybe, doctor, this is so much bleeding, it could be a cancer.
Okay. So, in which way I can help you today?
Doctor, give me any medication or any lab test so I can know what's going on.
Mm-hmm. Okay, so let me check if I get it straight, Madam Fatma. You came today because you noticed that your period is become heavy, and you are worried. Maybe it is a serious problem, and you want to from me to help you. Is that all?
Yes, doctor.
So may I check you, please?
Sure,
Uh,
doctor.
So I will do vital like but blood pressure, pulse, temperature, and I will check for your eye and for your nail, and I will check for the thyroid, your neck, and I will do palpation to you. I will touch your tummy.
Okay.
Okay.
Um, Patient is anemic and BMI is 29, blood pressure 122 by 76, pulse is 86 regular, abdomen soft, non-tender.
Mhm.
Okay.
Okay.
Otherwise normal.
BMI is okay. So from you told me, Mrs. Fatima, from you told me, and after I'm checking you, I think you have what we call in medical term oli- um, oligomenorrhea, okay, and anemia,
Okay, doctor.
okay.
Okay.
And for now, do you have any idea about it? Sorry. Do
No,
you?
doctor, what is it?
Yeah. Actually, anemia is this one your RBCs in which is the cell that carry oxygen uh, uh, to your tissue is become less, and menorrhagia is when you like have frequent period like what you have and heavy, like it come more frequent. Am I clear for you?
Okay, doctor.
Maybe because this like a heavy period, you got this anemia. Okay, for now, how about doing for you blood test like full blood count? I will do also. It's better to do ferritin, and I will. It is better also to do um, imaging to your tummy called ultrasound. Is that okay with you?
Okay, doctor.
So okay, if If like I find ferritin is low, at that time I can start. It is better to start for you what we call ferrous sulfate, and if it is normal, at that time I can do like hemoglobin electrophoresis to search for another cause. So for this bleeding, for this irregular
Mhm.
bleeding, how about referring you to woman doctor, because you told me that you have you awake at the night to change your bath and you feel pain after sexual intercourse. What do you think about that?
Sure, doctor. But doctor, yeah, can it be a cancer?
And do you have any weight loss,
No, doctor.
any lump bum in your body?
No, doctor.
Okay, so I think it is not a cancer, because your symptom not like a symptom of cancer, and from your history, it is like guide us to this diagnosis. What do you think about that?
Okay, doctor. So, I'm going to start any medication.
Yeah, for this, I told you, if the result of investigation came with low ferritin, so I will start with for you ferrous sulfate. But regarding heavy
Okay.
period, I can give you what we call northisterone tabs, 5 milligram. Use it 3 times a day,
Mm.
starting from day 5 up to day 26 from your period, next period. Okay.
Okay, doctor.
Okay. I also it's better to do for you thyroid function test yeah, to check your thyroid, because you told me you have a thyroid problem.
Okay.
And
Yes.
even
So,
also
time's up.
I want sorry,
Mhm. Time's up. Do you want
uh,
to add something else?
I want to follow up on safety netting.
Yeah,
I,
safety netting.
yeah, I
What
want to
will
see
be given?
the result of the investigation. But at any time, if we feel like you are symptom don't improve, or you have severe heavy bleeding, don't hesitate to come to me immediately.
Okay, doctor. Okay, Dr. Nahala. In this case, let's go from the beginning. The
Mhm.
patient was 38 years old, Mrs. Fatma. Um, since last 8 months, she is not sure about her cycles. Sometimes 21 days, sometimes 40 days. It's unpredictable for her. So, total duration, you didn't ask, and the total duration should be asked 7 to 8 days. Okay. And intermenstrual bleeding, she said occasional light spotting between the periods. So we need to ask that if this light spotting is before your starting of the next period. Sometimes it happens that patient is having 1 to 2 days before mild spotting, and then later on they get the periods. So we need to rule out like intermenstrual bleeding for how much. Is she having a lot of bleeding or just spotting? And postpartum bleeding, she didn't have dysmenorrhea. Um, uh, did you ask? I think you didn't ask. It was more cramping than before. She was having pelvic pain, but she's taking some painkiller, which is managing her pain. The red flags, she is having persistent pelvic pain, mild cramping, but only during the menses, not no constant pain. Bloating or change in bowel habits or weight loss was not present. Family history of any endometrial and colorectal cancer should be asked straightforward. Like, if do you, if since you are concerned, do you have any history of cancer in your family directly, or any history of major diseases in your family? Anemia symptoms should be ruled out in every menorrhagia case. Here, she was feeling more tired, slightly lightheaded, and but no chest pain or the palpitation. Ob's gynae history, you didn't ask, but she told you she's living with the 2 kids. She had 2 normal vaginal deliveries, and she also had one miscarriage. Okay. No history of fibroids, no pelvic surgery, no history of, again, we need to rule out any STIs, any PIDs before. It's very important since here the patient is not uh, saying anything like about the pregnancy anymore, but sometimes people are concerned about pregnancy. So if there is ongoing PID or STIs before, so it might affect the fertility. Okay. In past medical, she's taking she's taking levothyroxine for hypothyroidism. Drug history, only one thing. No smoker, no alcohol. You didn't ask for smoking and alcohol. And about the weight, sleep, and exercise. Okay, psychosocial should be asked like, are you smoking, taking any alcohol? How's your diet in general? Your exercise, your sleep pattern, and BMI she knows. So she has increased BMI around 29. Eyes, you asked about everything like she was saying maybe could be because of hormones or it might be because of some cancer and she needs some lab test. Okay. On examination, there should be vital signs, abdominal examination, and for masses or tenderness, pelvic examination, we will say that with the speculum and bimanual in the presence of chaperone in complete privacy. Findings we will provide is the patient is slightly pale, so she is anemic, and sometimes only this patient with the menorrhagia with one finding that is patient is pale is enough to know that the patient is having anemia. So we will start the ferrous sulfate right away if she is having anemia without any major red flag. BMI 29, blood pressure was told, and everything else was fine. Likely diagnosis is abnormal uterine bleeding due to an anovulatory cycles. Here we need to rule out any structure or endometrial hyperplasia, so a scan should be done. In primary care, we need to tell first thing about the pregnancy test. Okay, pregnancy test and FBC you have done ferritin if it's available. TSH as she is on hypothyroid, so we still have to do the TSH to ensure the control. Whenever we are asking for the menorrhagia, we need to know about the coagulation screen. Uh, uh, is she having any bleeding from any other side or any bruises on the body? If you suspect that she is having family history of any coagulation disease, pelvic ultrasound to assess the fibroids, and consider endometrial sampling or referral for hysteroscopy if the patient is having persistent intermenstrual or irregular bleeding, age over 45, strong risk factor of endometrial cancer. Firstly, we will explain this pattern of heavy and irregular periods is common and often due to the changes in how regularly you ovulate or benign condition like fibroids. Your examination is so far reassuring and we will arrange some tests to make sure there is nothing serious. And medical treatment option tailored to the contraceptive needs if she wants any. Okay, here levonorgestrel intrauterine system IUS is the first line for both heavy bleeding control and endometrial protection. Other option can be included, like you, as you said, Dr. Nalat, also the tranexamic acid for, during the menses, if there is no risk of VTE, NSAIDs during the menses for her pelvic pain, COCP if no contraindication, if the other things are not working, and cyclical oral progestogen if other options are not suitable. And manage the anemia like start oral iron if serum blood count shows anemia, full blood count.
Dr. Musarat, cyclical progesterone from which day until what? Which day?
Okay, here is complete. I'll tell you. Just give me a sec. Okay, so for menorrhagia in the primary care, first line is IUS. Okay, here we need to rule out two things. First, there is no uterine pathology, or if there is any fibroid less than 3 centimeter and any adenomyosis. Okay, other the treatments we need to know. One is non-hormonal and the other one is hormonal. Okay, non-hormonal is tranexamic acid, that is 1 to 1.5 gram TDS or NSAIDs, and it will start on the day one and continue till the heavy flow. This is for the transamic. And if we come on the hormonal pills, it is cyclical progesterone like norethistron, most likely 5 milligram 3 times a day from 5th day to 26th. Okay, but if someone is prescribing medroxyprogesterone that has 2.5 milligram of dose, it is 5 to 10 days, beginning on the days and 16 to 21 day of the cycle.
So sorry, doctor. Is this patient not for refer?
This patient, as she is having intermenstrual bleeding, we will give her a referral, but still we need to rule out
Mm,
after the examination and any scans done.
okay.
Oh, so Dr.
Okay.
Musarraf, before
But
prescribing IUS,
so so
we
ultrasound
should
there is no result. Oh, no.
No,
Okay.
not here, but we will tell that I'm following you up after this investigations. Okay.
Okay.
Dr. Musarat,
Yes,
can
doctor.
we give IUS or we need to refer the patient for this IUS and COCP treatment?
This is in the specialist care,
Thank you.
and
not
before
COCP,
prescribing
IUS.
IUS, should
IUS
we
is for
ask
this.
that is there any plan for pregnancy?
Yes, yes. Firstly, we have to ask if there is any plan of pregnancy, then our will be no non-hormonal pills first. Okay. So, and to refer to the gynecology if you're suspecting Asherman, so we need to know about the previous pregnancies or any miscarriages, fibroids if it's more than 3 centimeter, okay, and any abnormality on ultrasound, okay, and mostly when the primary care treatment is failed, like tranexamic acid and in hormonal, mostly cyclical and cyclical progestrogens. If they are failed, then we have to refer the patient.
And what if a fibroid is less than 3 centimeter? Then what we can tell?
Less than 3 centimeter is treatable here, and IUS is the first line for less than 3 centimeter fibroid. On the
Dr.
GP
Musarraf,
level, you just, yes,
sorry, you complete first.
yeah, so on the GP level, first line we have to start from the non-hormonal tranexamic acid and NSAIDs. And while we are waiting for the lab reports and also the scan. And sometimes if you get the confusion here, because sometimes the patient is not the straightforward case, so you can say, I'm going to ask for the specialist opinion. And furthermore, I'll let you know after your investigations are in my hand. Okay.
Uh,
Yes, Dr.
doc,
Na-
yeah, yeah. Assalamu alaikum, Dr. Musarraf.
Walaikum Assalam.
Dr. Musarraf, can you please summarize the management for this particular case? Like you explain all the DDs and according to the DDs, the management. For this case, what would we say to the patient?
Okay, firstly, we will tell now from the first line, she is having hypothyroid. Rule out if it's controlled. Okay, so TSS should be done according to that, the dose adjustment if needed. Then medical, um, if she needs any contraception, we will consider IUS is the first line in this case. Okay,
Mm-hmm.
and you can all, it depends. If the patient doesn't want the kids, then it's IUS after the specialist input. And if she doesn't, she wants the kit, then first line is tranexamic acid and NSAIDs. Okay.
Okay.
Meanwhile, third
But
thing we have to manage the anemia.
mhm,
We will start on the
yeah,
oral iron since she is having anemia symptoms. Okay. Fourth is also address her concerns about the cancer. It's more likely it's not cancer, but due to your hormonal changes, we still need to know more after your results are with us. Okay, and then safety netting. This is all this in this case.
got it.
Is it
But
clear
we
now?
refer her to, yeah, yeah. But we will refer her to the gynae if for two reasons. If she asks for contraception, and the other thing because there is intermenstrual bleeding history.
Yes, that's
Okay.
a red flag. Okay, but she said she's occasionally having. So could be one time, but it's not regular. But it's persistent. Like she's saying, after between every period I'm having intermenstrual bleeding, then yes, it's a red flag. You will refer the patient straight forward.
And even also
Oh,
awaken anxiety to change her path is a red flag, yeah?
Sorry?
Awaken at night to change her path is a red flag, yes?
Yeah, it's a red flag. She wasn't waking up at night. Okay.
okay. Thank you so much.
So next, who wants to do the case? Dr. Aksa.
Yes, ma'am. Yes, ma'am.
Okay. So patient Nadia, 51 years of age, came to discuss her problem with you. Please proceed with history and management plan.
Okay. Hello.
Your time starts now.
Okay. Hello, my name is Dr. Raksa. I'm one of your attending physician here. So, Miss Nadia, can you tell me what brings you here today?
Yes, doctor. Actually, I think I'm going through the change. I'm getting this something changes in my temperature, and I'm not sleeping.
Okay. Miss Nadia, would you like to add something else in your condition?
Y- Yes, doctor. Actually, this lasts 2 years now, and my periods are becoming irregular. And also, I'm
Okay.
having the similar condition with the face. I'm having some burning sensation on my face, and I cannot sleep these days. I'm more irritable.
Okay. Okay, Miss Nadia. So, I would like to know that what's your last menstrual date?
Sorry.
What is your last menstrual date?
And also, it was 10 months ago.
Okay, it was 10 months ago. Okay. And how was the flow during those days?
It was irregular.
Irregular. From the last 10 months?
10 months ago, I had the period, and it was irregular before having.
Okay. And do you notice any pain during your cycles?
No, doctor.
Okay. From the last month, is your cycle was regular, irregular?
Before 10 months, sorry, there is a voice distortion. Can you repeat again?
Before 10 months, your cycle was irregular?
Yes, doctor. Before 10 months, it went irregular, and the last menstrual period is 10 months ago.
Okay. And how was your mood?
Doctor, my mood is so much irritable and sometimes low.
Okay. So, what is your age of onset of menses?
13.
Okay. And do you notice any bleeding after the descendment?
No, doctor.
Do you notice any dryness over the your lower passage area?
Yes, doctor.
So, are you intubated with someone?
Uh, no, doctor.
Do you notice any kind of pain on your lower passage area?
No, doctor.
Okay. So, Do you have a, are you having a kids?
No, doctor. Sorry,
Uh,
kids? Yes, doctor, I
yes.
have two kids.
And how was the mode of the delivery of yours?
How was that?
Mode of delivery.
It was normal.
Okay. After 10 months, do you know, do you have a history of any abortions or miscarriage?
No, doctor.
Okay. Did you get your cervical smear from your lower passage?
No, doctor.
Okay. Do you notice any other kind of bleeding from down passage after the 10 months?
No, doctor.
Okay. Do you have any other long-standing medical illness?
Doctor, I have this high blood pressure.
Okay. And what do you take for this, your BP?
Um, I'm taking amlodipine.
And are you taking regularly? Is it control your
Yes,
BP?
doctor. Yes, doctor.
Okay. Do you have any surgeries?
No, doctor.
Okay. Is there any history of any disease which runs in your family?
Doctor, my mother had similar problem when she was around 50, and then
Okay.
she had some bone problems. She said osteoporosis. Otherwise, no other problem.
So usually, at what age menstruation was stopped in your family? Do you know?
No, doctor, she was around 50. I'm not sure exact age.
Okay. So what do you do for a living, Miss Nadia?
I'm a housewife, doctor.
Okay. And do you smoke?
No, doctor.
Do you drink?
Occasionally.
Okay. And what kind of diet you usually take?
Doctor, I'm taking mostly sugary diet and sometimes junk food.
Okay. And are you physically active?
No, doctor.
Okay, Miss Nadia. So what do you think? What is happening with you?
Doctor, I think it's something menopause I read on the internet.
Okay. And do you have a specific concern about this condition?
I'm worried this is how I will feel for the rest of my life.
Okay. And I will address separately in the end of my consultation this. And what are you hoping from today from me?
I want you to give me some options to make me feel better. And doctor, there is some HRT I read on the internet. Can I take it?
Mhm. Definitely, I will address this also. And Miss Nadia, how does it affect your life daily?
Doctor, it's actually making me worried because I'm all the time irritable. I'm fighting with my husband, and he's
Okay.
not happy with me also. So that's all.
Okay, Miss Nadia. Let me summarize for you that you are experiencing some of the changes in your body, that is changes in the temperature, which is on and off 2 years ago, and burning sensation over the face, and not sleeping properly. And 10 months ago, you have a cycle which was irregular. Would you like to add something else, Miss Nadia?
No, doctor. Doctor, I'm just taking these herbal remedies for my hot face,
For this, sorry.
for a hotness in the face. I told you
Okay.
this burning sensation in my face.
Okay, okay, okay. Okay, Miss Nadia, I would like to offer some investigation. So could you do it for me?
Sure, doctor.
Okay, I would like to do a simple blood test that is FSH. Okay, now Miss Nadia, I would like to address some of the lifestyle changes that will bring change. You can make small steps by changing in your lifestyle and bring a change in your life. So could you do it for me, Miss Nadia?
Sure, doctor.
You can do the regular exercise, which reduces your flushes and improves mood. And as you told me that, let me summarize for first. I would like to summarize this that you are experiencing your signs and symptoms suggesting that you are experiencing of condition menopause, which you already read in the internet. and you are also concerned about the HRT. So, menopause is a normal symptom that is experienced by most of the women, all the women after the certain age. And for this also due to the deficiency of hormones, leading to some of the symptoms in our body, which we control by our lifestyle management. So, could you do it, Miss Nadia, please?
Sure, doctor. I'll try.
Okay, you have to reduce your alcohol intake, and you have to do some of the regular exercise as per your convenience, and make a healthy diet plans which include the fresh fruits and vegetables, and also the include the calcium and vitamin D, because of the lack of the hormones. Mostly your bones is also getting hurt, or you have to maintain your good sleep hygiene. These are the measures that you can take easily, and you can definitely see a benefit from this. Are you with me, Miss Nadia?
Yes, doctor.
Okay, Ms. Nadi, let me tell you about some of the HRT treatments. As you asked me earlier about the HRT, these are kind of treatment which will be started by the specialist. But before this, we are going to confirm that you are actually having a menopause or not. That's why I'm going to do this simple test, the test FSH. And after two readings, I will make sure that you are having a menopause. HRT is definitely, there are so many kinds of HRT which can start by the specialist according to your indication. If I'm going to refer towards the specialist for your HRT discussion, because if they will find a definite indication in you, so they will start definite type of hormonal replacement therapy. Meanwhile, you have to take care of your bones and take care of your blood pressures also. And you can take a leaflet about your condition from our desk, so you can give it a read, and if you have any query, you can come back towards me, and you can ask anything from me. And also, if you notice
Okay.
any kind of bleeding from your down passage after the cessation of your menstruation cycle, or any pain, any bloating sensations in abdomen, or any abnormal thing that you will notice in your body, you can come back to me, or you can consult with the doctor also. Are you with
Okay.
me, Nadia?
Yes, time's up,
Do
doctor.
you, okay, thank you.
Okay. All right. So let's begin from the beginning. Well done. The examination wasn't required and you didn't do. So this case is simple menopause. When the patient is above 45 years, we don't need any other investigations. No FSH is needed. Okay. Right away, if the patient is above 45 and having the symptoms of hot flushes and her mood changes, loss of libido, also the dryness, then straightforward it is the menopause. Here, the patient having poor sleep, more irritable. When the patient is low all the times, we need to rule out suicidal thoughts. Two questions in menopausal women and hypothyroidism because they are feeling depressed. So, are you feeling depressed low mood lately, and are you enjoying the things that you used to enjoy in your life before? Any thoughts of harming yourself, we need to rule out in this condition. Okay. Impact. Did you ask impact because she was feeling embarrassed because of sudden sweating and sudden hot flushes? Okay,
Yes,
and
Dr. Sartaj.
yeah. So her relationship was affected. That's what she told. Red flags. You asked about every red flag, but if she's having only 10 months, she needs 2 more months to be confirmed as a menopause. So if they're in any postmenopausal bleeding after 12 months of amenorrhea, then it is a red flag. She wasn't having any bleeding since in 10 months, and we can wait 2 more months after that. If she is having the postmenopausal bleeding, then it's a red flag. We have to refer for any endometrial carcinoma. Any abnormal vaginal discharge. Okay, any abnormal vaginal discharge, pelvic pain, weight loss, or change in the bowel habits? She wasn't having any. And breast symptoms, no lumps and no discharge. Past medical history, only hypertensive. We need to ask about before telling about the HRT if there is any family history of venous thromboembolism, or any stroke or heart disease. Okay, drug history, only amlodipine and herbal remedies for hot flushes. She wasn't taking any hormonal contraceptive. Non-smoker, BMI is slightly increased. In lifestyle is sedentary, mostly no exercise, nothing at all. So mother had menopause. In this condition, patient is already aware of menopause. So you said, as you know, and you read on the internet, it's menopause, and for that we will be giving you some lifestyle changes and some medication if needed. Consider investigation only if the atypical features or less than 45 years of age is present. Otherwise, just lifestyle changes, and we can do lipid or profile glucose or like HbA1c to assess the cardiovascular risk. She was hypertensive and also obese, so just to rule out. Explain the diagnosis, that it is declining the function of your normal hormones, and that's why you're having all this condition. And it's manageable and treatable, and it doesn't stay for forever, as she was concerned that it might stay with me for forever. No, it doesn't stay for forever. Weight management, regular exercise, reduce the caffeine and alcohol if she's taking. Sleep hygiene is very important, and tell her to wear the light clothing. For vaginal dryness, moisturizer like estrogen and the lubricants for the dryness is indicated. The patient is having a relationship problem. In HRT, as she is 51 and within 10 years of menopause with no major contraindication, systemic HRT can be considered. And she has an intact uterus, so she needs combined estrogen and progesterone for endometrial protection. Okay, we will discuss this option, but we cannot proceed with the HRT. So for that, you can also refer to the specialist. Since the patient is concerned about the HRT, few more things we need to add, that the benefits are symptoms relief, better sleep, and bone protection. We need to say these three words, that symptom relief, better sleep, and the mood and bone protection. And also it has some small risk of VTE. The local vaginal estrogen is giving monitoring and follow-up and review in about 3 months, and assess symptom control and side effect, then yearly once stable. Okay, and if there is any irregular bleeding during the HRT, then the patient has to have a follow-up with us. And also encourage her breast screening, also breast, so if there is any cancer, and routine health checkups. Safety netting is again review of for any postmenopausal bleeding after 12 months or after starting on the HRT. Advice to return sooner if the mood is worse or she wants to harm herself or someone else. Okay.
Dr.
There
Musarat,
was a question. Yeah.
when we can do the FSH test to confirm the diagnosis, in which
If
condition?
if the patient is less than 45 years.
Okay.
Okay. And
Mhm.
in the last scenario, we were discussing about IMB. I want to clear one more thing. Intermenstrual bleeding is a red flag only in few conditions, like postcoital bleeding should be there, IMB plus PCB should be there, obesity is there, PCOS, diabetes, or the patient is using tamoxifen, any family history like significant of endometrial cancer, and the IMB intermenstrual bleeding is persistent, like in between every period. Okay, so for one IMB, we won't take the patient, but with these scenarios, it's a red flag, we will refer urgently in 2 weeks. Is it clear now? Because I've felt that it wasn't clear in the last discussion.
Can you please repeat, Dr.
Okay.
Masarat, the conditions?
Yeah, so it's red flag if IMB coincides with the PCB, postcoital bleeding, number one. Number two, IMB plus obesity plus PCOS or diabetes or tamoxifen use or family history of any cancer, like especially endometrial cancer, or IMB alone, but it is persistent between every periods. Okay?
Okay.
Yeah. So
Dr.
next
Musarat, can I
doctor.
do? Can I
Yes,
do a
Dr.
case?
Maida. Yes, sure.
Dr. Musarat, I have a question. Assalamu
Hmm.
alaikum.
Walaikum
Um,
assalam.
in that case, there was a patient with we did the menopausal patient. In that case,
Yes.
can we advise her CBT and fluoxetine also? Because she was saying
CBT can be,
I was fighting with my husband, and I had very low mood and these kind of things. So can we advise her CBT?
yes, we can advise our CBT. It's a
And
very good question because
we
CBT before SNRIs,
yes, and we have to give her fluoxetine 20 milligrams OD also.
fluoxetine, yes, because this is one of the SSRIs.
Y- Yes. Okay.
Okay, it could be sertraline, um, but there could be more options like sertraline, gabapentin, clonidine. It's written also. But regarding fluoxetine, it's not indicated in every patient. The patient who's already taking tamoxifen, we need to be very cautious because it has drug side effects. So fluoxetine or paroxetine, not with the tamoxifen. First line is always sertraline in these patients if they need antidepressant after CBT. Okay,
Also, Dr. Musarat, can
and
we refer this patient to for DEXA scan, as she mentioned that her mother has also osteoporosis and she's having menopause. So can we refer her for DEXA to assess her bone health?
DEXA scan has complete different approach. Like there are few things where we need to send her for the DEXA. In this case, it's not written in this management. Okay,
Okay.
we can check it out later. What criteria is followed for DEXA in osteoporosis cases.
Maybe we can tell her to do FRAX score first,
Mm-hmm.
and then if she is on high risk, then can go for DEXA. But first, we can tell her about FRAX score.
Yeah, because DEXA doesn't just go on only family history. There must be
Yeah.
any previous fractures or there are few conditions we need to first rule out for DEXA.
No,
But FRAX we
I'm not
can
asking.
give.
No, I'm not asking on family history background. I'm asking because she is now going through the menopausal symptoms. So we have to assess the bone health.
Over
But that is,
55 years, I guess there is,
I think
yeah,
if it is
cut of
65,
55.
female
Hmm.
65, male
Yeah,
75. If
male
she is
60.
65,
Okay.
yeah, if she's a female 65, then you should
Hmm.
do DIXA. But she is, in this case, she is
Yeah.
less than 65.
She is 51 years, yeah.
Yeah,
Yeah.
yeah. Okay, yeah. This
Yeah, so
point
that's why I
is
said that
important.
there is age criteria or any previous fractures and things like that. We
Hmm.
will
Yeah.
discuss it when we are
But if
discussing
she
the
is
topic.
having a family history, then we can tell her about FRAX score in this case.
Yeah.
Hmm. Okay, okay. Thank you.
Okay. Just give me a minute. Someone asked about the FSH. Also, FSH, if we are checking in less than 45 years, we still have to do it on 2 occasions. Okay, one FSH finding or one reading is not enough to rule out premature ovarian or early menopause. FSH should be done on two occasions, 1 month apart, and it should be more than 30. Okay. FSH should be done from 2 to 5 days of the cycles, not on the random day. And there is menopause and perimenopause, so FSH can be normal in perimenopause. Can someone tell me the difference between perimenopause and menopause? Anyone?
Maybe when
Okay.
it's already 1 year of the last menstrual period, it's a menopause, and
Yes.
if it's still under 1 year of window period, then it's perimenopause.
Yes. So under 1 year of the stopping of the periods, if it's perimenopause only on two conditions: if she is having vasomotor symptoms and infrequent periods, then only it's perimenopause. Otherwise, it's
Hmm.
menopause after 12 months. So next case,
Yes,
Dr. Maida, are you ready?
yes, ready.
Your patient, um, 62-year-old female, Mrs. Laila, came to discuss her problem with you. Please proceed with history, examination, gray, and management plan. Your time starts now.
Hmm. Hmm. Hi, good morning, Miss Laila. I'm Dr. Maida here. How can I help you today?
Uh, Doctor, actually, I started some spotting from down below.
Okay, Miss Laila. Is it okay if you will tell something more about your condition?
Yes, doctor, actually, since many years, I don't have periods anymore, but now I feel
Hmm.
some
Hmm.
spotting from down below. My
Oh.
periods stopped like at 52 years of age. And
Okay.
since then, nothing, I didn't notice any bleeding, but it's been
Hmm.
1 week
Hmm.
now, doctor.
Hmm. Okay. Miss Leila, I would like to ask few more questions. I hope you will cooperate. May I know that it's total how many days it's been you have been experiencing this bleeding?
1 week, doctor.
1 week. And is it heavy or just a spotting?
It's slightly a heavier bleeding, like light
Okay,
period.
light periods. Okay. And are you feeling some abdominal pain along with this bleeding?
No, doctor.
Okay. Any other complaints with this? Any fever, lethargy,
No, doctor.
any history of weight loss?
No, doctor.
Okay. Do you have any other condition like diabetes or hypertension?
No, doctor, just I feel fatigued all the time. And I have this
Okay.
bloating also. My tummy
Bloating.
feels swelling, like swelling. Yeah.
Okay. Okay. So this bloating is also since 1 week or a prolonged duration?
Since few weeks now.
2 weeks now. So any change in your bowel habits with this bloating?
Yes, doctor, I am I'm passing more urine, more
Hmm.
often,
Hmm.
but my bowels are
Hmm.
normal.
Hmm. Okay. Any history of discharge from down below?
No, doctor.
Okay. So, Miss Leila, do you have any other disease related to this your uterus, for example, any previous surgery or any problem with your menses before?
No, doctor, but I was having a mood change and they gave me
Hmm.
some HRT and I took it for
Hmm.
like 3 months. Oh, sorry, three
Hmm.
years after
Hmm.
menopause, after stopping
Hmm.
of
Hmm.
my periods.
Hmm.
But
Hmm.
I stopped it 7 years ago now.
Okay, it's been 7 years you stopped HRT,
Yes.
and now you are not taking HRT or any other medication.
No, I'm taking amlodipine for blood
Hmm.
pressure, metformin for
Hmm.
diabetes, and atorvastatin.
Hmm. Okay. And your blood pressure and all these things are under control?
Yes,
Your
doctor.
diabetes? Okay. When did you visit your doctor for follow-up last time?
6 months ago.
Okay. And so your readings were normal.
Yes, doctor.
Okay. So, Miss Leila, I would like to know that are you married?
Yes, doctor.
Okay. And you are living with?
My husband.
Okay. And any problem with your relationship with husband?
No, doctor.
Okay. And may I know about your body weight and height?
Doctor, I am 33 BMI.
33 BMI. And is it constant? No loss of weight?
No, no, doctor, not at all.
Okay. Okay. Miss Leila, may I know about your dietary habits?
Um, Doctor, I'm taking general diet. Sometimes I take green vegetables,
Mm,
sometimes boiled
mm,
food.
mm, mm,
But
mm. Okay.
I don't think so. It's enough for me because I feel fatigued all
Mm,
the time.
mm, mm. Miss Leila, do you get enough time for exercise?
No, doctor.
Okay. So Miss Leila, I assume you are housewife. Am I right?
Yes, doctor.
Okay. Any stresses in life?
No, doctor.
Okay. Miss Leila, is there any family history or any family member of your in your family is suffering from any type of cancer
No, doctor. But
or
my
any
mother
other
had a
major?
stroke and diabetes.
Mm-hmm. Okay. What about any other disease in your family?
No, doctor.
Okay. So Miss Leila, what do you think what's going on with you?
Doctor, maybe this is something I don't know, maybe not normal. I'm a bit worried, but maybe it's
Hmm.
normal.
Hmm. Okay. So is it concerning for you in some way?
Yes, doctor, I need some medication, so maybe it just get to stop again.
Hmm. Okay. So what do you expect from today's consultation?
I just want you to give me some medication to stop it.
Okay. And is it affecting your life in some way?
No, doctor.
Hmm. Okay. Uh, Miss Lala, do you have any previous report of any ultrasound or anything you
No,
have?
doctor. No.
Okay. Any pap smear done in past?
No, doctor.
Okay. So, Miss Leila, what I have collected data from you, I would like to summarize that you are 62-year-old and you have been suffering from, since 1 week, you have suffering from mild bleeding, and your periods were stopped when you were in 50s. Now, after many years and after stopping HRT, you are facing this problem, and you are a bit concerned about it, and you want me to give you some medicine to stop this bleeding. Am I right?
Yes, doctor.
Okay. So, Miss Lala, based upon your history and examination, based upon your history, I would like to send few investigation, and I will also send you to gynecologist so they can have a better examination and some investigation which are needed at this stage. So. Because I have been thinking that you have been suffering from a condition which is called postmenopausal bleeding. Did you ever heard about this condition?
No, doctor.
Actually, Miss Leila, as you said that your periods were stopped many years ago. When there is a gap of few years, we label it as menopause, and you took some medication which is called HRT for few years. Sometimes what happens, there is some imbalance or happens in or some hormonal imbalance which causes bleeding, which could be a serious situation. So it's better to consult a gynecologist for a better evaluation So in case if it is serious, it can picked early. So that's why I'm referring you to a gynecologist so they can do some test for you. These tests may include some endometrial biopsy and maybe a pap smear to rule out any serious condition, for example, endometrial carcinoma. Once you will done with these tests, and if everything is normal, you can come back to me. We can talk about a few things for your lifestyle modification and your further screening test, which includes mammogram and pap smear regularly, and also some lifestyle modification, like I would advise you to have a walk, relax yourself, and more emphasize on healthy diet and stress-free life. Do some
Okay,
exercise
doctor.
daily.
So,
So I
doctor, I
hope
have
you
to go to specialist.
yes, I would refer
When?
to a specialist. That will be a best option in your case.
So, doctor, when should I go?
I would refer you right now. I'm writing a referral letter. I'm sending you at on urgent refer.
Okay, doctor. So, doctor, why can't you give me any medication to stop it?
Actually, according to your age, because your age is above 60 and you have used HRT, you are postmenopausal, your bleeding was stopped many years back. So, any postmenopausal bleeding is not that simple that we can give medication and just stop it. So, it should be investigated and treated accordingly. So, it's not
Thank
in
you.
your favor.
Hmm.
Okay. It's not in your
Okay.
favor if I will give you some medication to stop this bleeding.
Okay, doctor. Uh, nice try, Dr. Aksa. Dr. Maida, sorry. Um, in this case, if I say that, doctor, can you please do the pap smear and then can you give me medication?
Pap smear will not be enough in your case because you have been suffering from bleeding. Pap smear is we do pap smear, but pap smear will tell us about cervical cancer, abnormal cell growth. In your case, I have been suspecting from endometrial cancer. So that need endometrial sampling, which can be done by a specialist under special care. That's why I'm trying to refer you.
Okay. Okay. So, Dr. Maida, I'll tell
Yes.
you two things regarding cancer, and there is a straightforward endometrial cancer in front of you. Postmenopausal bleeding, no matter if she's not losing any weight, maybe she's not aware of and losing any weight, and the examination is not there also. It's only a counseling station. Counseling station, in a way, you are not having any report to break the bad news. So, firstly, this is not a breaking bad news. So, we won't use any word of cancer. Okay, even though it's a straightforward cancer, but we will tell that, Miss Laila, I'm not going to give you any medication at the moment. Firstly, I need to refer you to the specialist on the urgent basis because the condition you're telling me right now is alarming for me. And for further investigation and management, I need to see, I need you to see the specialist first. Okay, and after that, I'll be following you up, and we have a lot to discuss about. Okay, this is one liner for the management plan, but you will extend since the management should be 2 minutes almost.
Mm-hmm.
Her BMI and her lifestyle, if she's taking any smoking, alcohol, and try to
Mm-hmm.
lower down her normal like high blood pressures and control her sugar levels. To talk more about that and to tell about her concerns and expectations. She's not
Mm-hmm.
worried about it, okay? And she expects you to just give her the medication. So she will
Mm-hmm.
at the end keep on asking for the medication. Doctor, can you just give me medication? No, the medication in your case won't help you out. Even if we stop the bleeding at the moment, it might be something dangerous that needs to be addressed at the moment. For that, I'm giving you urgent referral as you gave. And safety netting is very important in 2 weeks urgent referral. Tell the patient if you feel um, uh, discomfort, so much pain in your abdomen, and heavy bleeding, that the soaking pads for hours and hours, dizziness, along with few more things, chest pain, shortness of breath, and collapse. Whenever you are referring the patient for 2 weeks of cancer pathway, then these are the red flags in postmenopausal bleeding. Okay. Otherwise, symptom management, like you can tell her, try to use pads rather than tampons for hygiene. And if the bleeding becomes heavier, then seek emergency help. Tell about the eyes. Tell her, as you told, as we discussed about it. And no cancer word should be used here.
Hmm.
Yeah, one question I did at the end, cervical smear. She was concerning that I didn't have any cervical smear before, so can I get it to just rule out whatever bad is going on? So tell her that it is not sufficient, it is not diagnostic of what I am suspecting, so that's why I am
Hmm.
referring you to the specialist. It's not a diagnostic for
Hmm.
endometrial. Blood test you
Hmm.
can do CBC for anemia and urea and electrolytes.
Doctor, why urea electrolyte?
Just her because of the baselines.
Hmm.
And transvaginal ultrasound is the gold standard for endometrial to assess the endometrial thickness. So in this case, in every postmenopausal case, we need to address. I need to see a scan of you, that is transvaginal ultrasound, to assess your womb
Hmm.
thickness. Okay.
Hmm. Hmm.
And if the
Hmm.
patient is aware and if already suspecting a cancer, then you will tell her more than if we find there is any abnormality on a scan, that then we might go for any tissue. We cannot say tissue. What we will say? We will check a portion of from your womb. You can say like this
Hmm. Hmm.
under the
Hmm.
microscope,
Like
because this is
somewhere.
endometrial biopsy. Yeah.
Hmm.
Okay.
I think patient understand the word sample. We can take sample from uterus.
Yeah. Sample. Yes, sample. We can say.
Mm.
Because sometimes layman is too much layman that we forget that they can understand normal words also.
Hmm.
Okay, all right. Anything else, or should we stop here? It's almost midnight now. All questions were done. There is one more case, but I guess it's enough for today.
Yes, I think enough for today. Tomorrow
Yes,
we will do.
Yeah.
Dr. Sarah.
Yeah.
Mm.
Tomorrow. Yeah.
Thank you
Okay.
very
Have a
much,
good
Dr.
night.
Nusara.
Thank
Thank
you
you.
so much.
Thank you, everyone. And if there is any
Thank you,
query
Dr.
that I
Nusrat.
couldn't address, please, thank you. Please put it in the group so we can discuss more over there.
Thank you.
Okay. Thank you.
Okay. Yes,
Thank you.
inshallah.
Okay, good night.
Good night.